Hey everyone, it's Dr. Parsa Salehi, and today we're going to be talking about Ozempic face. So I think for the last few months, questions about Ozempic, Mounjaro, that class of medications have been some of the most common questions I get from friends and patients. Is it worth the risks? So the benefits of Ozempic are clear. I mean, it really does help diabetic patients. It really does help overweight patients lose weight. The question is though, should you be taking Ozempic if you do not have the health problems related to obesity or diabetes that Ozempic is treating? Ozempic is not risk-free. Ozempic has side effects. The reason it's approved is that the thought is for a diabetic patient or someone who is very overweight, being diabetic or being very overweight itself has a lot of, for example, cardiovascular disease, heart attacks, strokes, things of that nature. So when you're faced with the risks of obesity and diabetes versus the risks of a drug that can treat the obesity and the diabetes, it seems like on the scales, the studies have shown that the risks of the drug are justified when in the context of those health ailments. The question is, what about when you aren't having any health related issues with your weight or you're non-diabetic? Then is it worth the risk to take a drug to help you just lose weight? And so if you come to me and you say, hey, Dr. Slate, I want to lose 15 pounds. One thing I could do is cut your arm off. I could cut your arm off and you'll lose 15 pounds like that. In fact, it'll never come back. But do you want to lose your arm to lose 15 pounds? The obvious answer is no. So cosmetically, is taking Ozempic, first of all, yes, you'll lose weight, but is it worth the other things it does to your body? Specifically, as a facial plastic surgeon, what I'm talking about is Ozempic face. When you see patients who are on Ozempic for a long time, it takes out the fat in their face. It really atrophies that fat and it causes the face to look hollower. And also with the atrophy of the fat, now the wrinkles and sagginess of the face become more prominent, something that you wouldn't normally see in someone of that age or someone who had a more volumized face. So cosmetically, I worry about this Ozempic face, which we're hearing more and more about because it's really destroying the natural volume of patients' faces. And long-term, I don't think that that's a great idea. From the medical perspective, if you look at the original studies, there are risks to your gallbladder, pancreatitis, kidney failure, increased risk of all thyroid cancers or malignancies. With that said, with that last one, the thyroid cancers, the European Union did say in October 2023 that there is no evidence now of the thyroid cancer thing, but still, it's a newer drug. Second of all, the use of it has become widespread, even for indications that it wasn't originally designed for. So, 5 years, 10 years, 15 years down the line, you have to think, we may not know exactly what this is going to do to your body. So with all that said, the summary is this. Yes, if you're having problems with diabetes or you're overweight, then I think you should talk to your doctor and see if you are a candidate to safely take these drugs like Ozempic. But if you're not and you're purely taking, if you have no health problems and you're purely taking this for weight loss to look thinner when you're not necessarily overweight, you really have to think, is this worth it? And as a plastic surgeon, it's not my role to tell you if it's worth it. What I can tell you is cosmetically in the face, we are seeing hollowing from the loss of the fat, and that's contributing to sagging and wrinkles. It's called Ozempic face. And medically, just from what I've read in the literature, there are risks that have been associated with it. In addition to the kidney, the liver, possibly the thyroid, there's also possible GI risks with gastroparesis, and we even have you come off these medications before you undergo a facelift or any surgeries with us for a couple of weeks. So just factor those in and talk to your doctor, your primary care doctor, or your endocrinologist, and figure out if this is the right drug for you. But I just wanted to raise awareness that I know in America we love the silver bullet and we love something that's going to just make us lose weight, but there might be some risks. I want you all to consider them before going on the drug. Have a good day and feel free to leave a comment or any questions and I'll try to get to them.